Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Brad, what are we talking about today?
Okay, today we're going to talk about people that have a stroke, okay? And we're talking about how they walk after the stroke, and specifically on the knee. This is a common
Problem that happens with people.
Knee hyperextension.
Right.
Okay, and it's one of those things that we're going to talk about a possibly fix that works very well that is overlooked a lot of times, I think.
Right.
Okay?
Should I show hyperextension?
Yeah, let's go.
Okay.
You can do pretty good.
I think so.
Yep.
So this is the knee that was involved. You know,
Right.
we got some weakness here, and so what happens, I step, and it goes back like this.
you
It
do that
hyperextends.
Very well, Bob. Nice
And
imitation.
one thing that it shows you is, do you want to go to the problems
Yep,
of this?
you bet. Let's go to the problems that can
You know,
cause.
one thing is it can throw you off and actually throw your balance off, and you can fall because
Right.
of this. It really
Exactly.
it catches, because sometimes it doesn't do it every time either.
Right.
But with most people it does. It goes like this,
Yep.
like this. The other thing it's going to do is it's going to actually start to damage the knee over time.
Right.
It's really jamming that joint when you
Exactly.
do that, and it's stretching out the structures behind.
Yep.
I've seen people who've had this where the knee starts bending the wrong way.
Yep.
It really is kind of a little grotesque.
Right. It looks like it hurts just to have them walk, but
And also, it takes a lot more energy to walk like this.
right. Right.
It's
exactly.
just not efficient walking, so it's going to cause you more stress.
Exactly.
So
what are we going to do to fix this? A lot of times people think about putting a brace on right away. Put a
Right.
nice brace on with lateral supports and all this. And I just had this early this spring. I had a gentleman with a severe stroke. He was hyperextending, and we went, hey, let's try an AFO, a plastic ankle support.
and so instead of trying to correct it at the knee, we're correcting it at the ankle.
Right, exactly. And it worked beautiful for him. He loved it. It felt better. He was walking better. He was so happy that we got that instead of having to wrap that knee support
Again, they
on.
do have knee braces. They also have what are called Swedish knee cages that
Right.
help hold it, Ben.
Right.
But they're very expensive and they're very bulky.
Right, they're not
So-
comfortable
No,
compared
they're
to
not
this.
comfortable, right?
So if you
And
now,
plus, you can see them. Where this thing, you can actually put this on, and for a lot of people, you can't even
right,
see
it's
it.
in the shoe underneath the pants. So this is just a standard AFO. Typically,
Ankle foot orthosis.
Right.
It's an ankle brace basically, so you can see it here.
the way I like to do is I get a standard one like this. This is kind of off the shelf. It'll fit a different number of different sizes, and if it works, then you get a custom one made, which are quite a bit more expensive.
Or sometimes you can just make slight alterations to
Sure.
these ones off the shelf, and they work fine.
Yep,
I mean,
that's true too, Bob.
In fact, some of the prosthetic guys will sometimes just make adjustments to these
Sure.
for them.
Okay, so what happens is, let's do.
Again, just showing you, once this is all in place, and if you put the pant leg down, it's very, you're not going to be able to notice it at all, basically.
Right.
Is that a person even has a brace on. So,
Why don't you stand up, Bob? Let's explain why it works, first of
Okay.
all. So this one is probably a little flimsy to work, but it may help. What happens is when the knee comes back to do that hyperextension right there, the brace right here, go ahead and hyperextend, is holding it. So it will
Right.
cushion it. It may not take care of all the movement, but it's going to cushion it so you don't get that snap.
right,
It's
it'll
gonna-
slow it down.
Exactly.
Yeah. So it'll look like more of a normal pattern. So instead of snapping back, it'll just slowly come back like that. And
Right.
You won't even see the difference.
Exactly.
See a problem. So it's a very simple solution, but it's very effective. And also then if you have some weakness at the ankle, it's going to also help support that.
Right, because a lot of times they're dragging that toe, so it's going to help keep
Right.
that toe up. So it's a win-win situation for the knee and the ankle. A lot of times people think of it just for the ankle. So
The other thing I've done sometimes, Brad, is I put maybe just a small cushion in the heel to raise the heel up a little bit. If the heel's up like this, it's not going to back knee as easy.
Sure, yep.
So you can take just a piece of quarter-inch foam.
Right.
Or sometimes people just take a piece of carpet and cut a heel wedge shape
right.
out of it and put it in their heel, in their shoe, and that gives them enough bend and it doesn't back knee.
So that's in the shoe underneath the AFO.
Underneath the
Okay,
brace.
yep, that makes
itself.
sense.
So those are all little tricks
All right.
to use. So
So yeah, I think there's a number of people out there who can benefit from this. And if you're watching, go ahead and see if you can find someone that has AFO. A lot of times the therapy department has old ones laying around that were used, but you can clean them up and do a
And
trial.
give it a trial
Yep.
of it, yep. I mean, the whole thing is you don't want to keep back kneeing. I know that for some people, they think that's a solution, but it's going to cause trouble over time.
Right,
Yeah.
exactly.
You're not going to get away from it, so. All right.
All right, very good. Good luck with
Thanks
that
for
AFO.
watching.
Oh, Bob, why?